to rely upon science, real, actual science around infection rates and potential mortalities. In my discussions with these experts, I've asked for honesty and hard truths. I ask that choices and consequences of those choices be laid out for me as clearly and starkly as possible. I've asked every one of these experts, what action can I take to save the most lives? Well, they've come back to me with one inescapable conclusion. To avoid the loss of potentially tens of thousands of lives, we must enact an immediate stay-at-home order for the state of Illinois. So that is the action that I'm announcing today. We have looked closely at the trajectory of this virus in countries like Italy and China. Left unchecked, cases in Illinois will rise rapidly. Hospital systems will be overwhelmed. Protective equipment will become scarce. And we will not have enough healthcare workers or hospital beds or ventilators for the overwhelming influx of sick patients. The only strategy available to us to limit the increase in cases and ensure our healthcare system has capacity to treat those who become ill is to mitigate the spread of coronavirus in the most robust manner possible. I don't come to this decision easily. I fully recognize that in some cases, I am choosing between saving people's lives and saving people's livelihoods. But ultimately, you can't have a livelihood if you don't have your life. Of all the obligations that weigh on me as governor, this is the greatest. If there are actions that I can take that will save lives in the midst of this pandemic, no matter how difficult, then I have an obligation to take these actions. Therefore, starting tomorrow evening, Saturday, March 21st at 5 p.m., until the end of April 7th, all our residents will be subject to a stay-at-home order. There is a great deal of misunderstanding about what a stay-at-home order means, so I want to clarify it for everybody. Here's what will stay the same. You'll still be able to leave your house to go to the grocery store to get food. You'll still be able to visit a pharmacy, go to a medical office or hospital, or to gas up your car at a gas station. You'll still be able to go running and hiking and walk your dog. Many, many people will still go to work. For the vast majority of you already taking precautions, your lives will not change very much. There is absolutely no need to rush out to a grocery store or gas station. On Sunday and Monday and Tuesday and every day thereafter, those will be available to you. Agriculture and the press, veterinarians and plumbers, laundromats and banks, roads, bridges and transit, the fundamental building blocks that keep our society safe and steady, will not be closing down. You can still pick up dinner from your local restaurant, pick up your prescriptions, and just spend time with your family. We are doing all that we can to maintain as much normalcy as possible while taking the steps that we must to protect you. That brings me to what will change. All non-essential businesses must stop operating. If you can work from home and aren't already doing so, now is the time when you must. The heroes of this moment, our healthcare workers, first responders, law enforcement officers, and the individuals and organizations like the Illinois AFL-CIO and other workers who keep our grocery stores and pharmacies running, cannot stay home. We need you. This executive order is fundamentally about the rest of us and what we can do to support the people on the front lines of this fight and the people most vulnerable to its consequences. We know this will be hard, and we're looking at every tool that we have to help you through this crisis. For our essential workers, we're going to make sure you have safe daycare to take care of your children while you do the critical work to save us and to keep us safe. For those who are asking to stay home, we're ordering state to halt all evictions. We need our local leaders to help ensure our families do not lose their homes. I'm also directing additional resources to organizations across the state to serve those experiencing homelessness.